So I'm going to be completing a head-to-toe assessment of my newborn. I'm definitely going to make sure that my hands are washed first and I have gloves on the whole entire newborn assessment. So 1 minute after birth, I'm going to assess the newborn's APGAR score. The APGAR score should range between 4 to 6, which indicates moderate difficulty, or 7 to 10, which indicates minimal or no difficulty with adjustments to extrauterine life. So if the newborn's assessment APGAR score is in between 4 to 6 or 7 to 10, that would be good, but I would also complete another APGAR score 5 minutes after to assess the APGAR score to make sure that it's between 7 to 10, score between 7 to 10, which indicates no minimal difficulty with adjustments to uterine life. So when I do my newborn assessment, I'm going to make sure that I have all my equipment, such as the bulb syringe, a stethoscope, auxiliary temperature, blood pressure cuff, scale with the protective cover, and a radiate warmer, tape measure, and clean gloves, which I have on. So I'm going to make sure that with the assessment there's good lighting and the infant is calm. And I'm going to start from the least invasive to most invasive so that the baby will remain calm during the assessment. So with the head to toe assessment, I'm going to start with the baby's posture, making sure that the baby is lying in a curled up position with the arms and legs in moderate flexation. I'm also going to be making sure that there's no resistance to extension of the extremities. I'm going to start assessing the skin of the newborn, making sure that they are pink, which is a normal finding, and there's no cyanotic, acrocyanotic in the arms or the legs, which is normal as well. But making sure that they don't have any jaundice, which would indicate which will indicate hyperbilirubinemia. So with the skin, I'm going to be looking for any Mongolian spots, which are darker bluish spots on the baby, which usually occurs in the newborn baby. I'm also going to be assessing for milia, which are the small white spots on like the nose that we do not rub off, which is also a normal finding. I'm also going to be looking for the stork's bite, which can appear as a red mark on the nose, the neck, or the upper eyelids, or the middle of the forehead. This will usually fade away with the second year of life. So I'm going to start with the head. The head should be 2 to 3 centimeters larger than the chest. So I would have a tape measure, and I will measure the head, around the head, from the back of the head to above the eyebrows of the baby. I'm also going to make sure that the head is 32 to 38 centimeters, which is also 12.6 or 14.5 inches. I'm going to assess the head of the newborn, making sure that the hair is fine, which is also normal. I'm going to be feeling for the frontal